my name's Clements, so interventional radiologist at the Alfred Hospital. The paper that we published was called the SPLEEN-IN paper, which is looking at splenic salvage after splenic artery embolization for blunt abdominal trauma. So blunt trauma, for example, motor vehicle accidents are very common. The spleen is the most commonly injured organ in blunt trauma. Management of splenic injury is highly varied. At many centres, there's a surgery-first approach, even in hemodynamically stable patients. And I believe that splenectomy rates are too high across the world. And the problem really is that splenectomy results in loss of immune function, and patients are then susceptible to certain bacterial infections, need vaccinations, need prophylactic antibiotics in the future, and at risk of overwhelming post-splenectomy infection, which has high mortality rate. So this was a 10-year retrospective study from our tertiary trauma centre in Melbourne, Australia. We included 232 patients, which is one of the largest series to date, noting that recent systematic reviews had less than 1,000 patients in the entire review. And in this paper, we showed that our treatment regime, so looking at treating AAST grade 4 and 5 spleens, and those with grade 3 and large volume hemoperitoneum, resulted in a very high rate of splenic salvage of 97%. So a few things. The first thing was that the approach we used was to treat grade 3 spleens with significant hemoperitoneum and all grade 4 and 5 injuries. We did that in hemodynamically stable patients. One thing that we found in the angiography for grade 3 splenic injuries found a significant number of occult vascular injuries. And so I think that others can learn that angiography will potentially find vascular lesions that weren't visible on CT. And we know that pseudoaneurysms and AV fistula are certainly important to identify so that they can help guide our treatment. We certainly had an interesting cohort with a bias in the way that we perform this procedure. As you'll see from the paper, we tended to perform a lot of proximal embolizations. And this is a great technique because it's fast, it's technically easy and quick, particularly in the middle of the night. And it's also, we showed that using pushable coils rather than the need for expensive, detachable coils or plugs was still very efficacious. So certainly our technique, which was a simple, easy and cost-effective technique, was very, very successful as well. So it's really important that we advocate for splenic salvage procedures as much as possible. We want patients to keep their spleen. The spleen obviously has an important function, and one of the biggest issues is that it has an immune function. Immunity has never been more important than it is right now in the crisis we're going through. By allowing patients to keep their spleen, we're able to reduce the need for routine vaccinations. We're able to reduce the need for prophylactic antibiotics in the future, such as for dental procedures or other minor surgical procedures that they're likely to need through their life. And we also reduce the incidence of overwhelming post-splenectomy infection, which has actually never been documented after splenic artery embolization. So they're all very important measures for the patient, because we know that these are often very young patients. And so there are many life years ahead of them, and we want them to have as normal a life as possible after what's otherwise a very traumatic event.